Welcome to the NYC Workforce Drop. My name is Greg Morris. I'm the CEO of the New York City Employment and Training Coalition. Today's Workforce Drop, Lauren Melodia, Director of Economic and Fiscal Policy, the Center for New York City Affairs at the New School. She's going to dig in on childcare, in particular, childcare, how it intersects with an affordability agenda, how it is that we need to think about how we subsidize and support folks who are doing that work. And then she's going to broaden the base and talk about what economic justice means and economic development means and how it is that we are in a position right now to turn our city in a moment of challenge, to something more. And I'm excited that she's here at the Manhattan Neighborhood Network studios to talk to us about what's next for New York City and building an economy that works for working New Yorkers. But I have to tell you, at this particular moment, before we jump into the pod, I have to give my genuine appreciation and gratitude to our super comms point person who made it possible for us to do this work. We started this podcast together, and it was really like, let's get something going. And the fact that we got this going and had a tremendous slate of folks who come to the table. Emily, none of this would be possible without you.
Thank you, Greg.
And I just want to say, extend my gratitude as you go on to your next fantastic job opportunity. In fact, I believe it's one of our podcast guests who are bringing you on board right now. Isn't that interesting? But I just two quick notes on Emily. Emily was fantastic. Emily from the Hayes Initiative, our comms firm. You've been our point of contact, Emily, and I thank you for that. We've been together for what, a year and a half, 2 years?
2 years.
2 years. Two great things. Number one, she teased me endlessly about my iPhone. And you know what? It's fine. I get it. And she was literally like, you're like your dad. Like, that's what she literally played the dad card on me. He also struggles with his phone.
Yes.
Greg, that's what I heard. Ouch. But the other always equally inspirational, the notes that Emily has given me through any event, any particular engagement with a reporter, always are the perfect, we all know this, it's like the sandwich, the cookie, there is you nailed it. Here's a few thoughts. This is what it'll read in text. You nailed it. Next. If you could remember not to interrupt every reporter while they're asking their questions, it might serve to benefit. But you know what? You really have grown. It really is working for you. That's the kind of feedback that I both appreciate and value. The lessons I have learned, the time that we have had together, has been an absolute pleasure and a privilege. And the next two podcast guests, Comptroller Mark Levine, and we're going to wrap up the season with Maria Torres Springer. I think we're going out with exactly the right bang. Yeah. And Emily, I just want to express to you my sincere gratitude for making it possible to do this work at this studio in this particular space. The work that you have done to support our media connections, the work that you have done to support Stephanie and me and Marina, our newest membership manager, and how it is that we think about what we produce and how we produce it, and just being relentless about helping us be better and better has meant the world to me. And I am so excited that you're on to your next step, and we'll celebrate at the end of this podcast season, and we will toast to you. Do you want to let people know where you're headed next?
Yeah, sure.
Come on over. Let's bring you over. Jump in. Tell everybody where you are headed next.
It feels weird to be here. I'm never on the mic.
You're literally on the mic. NYC Workforce Drop. And normally, typically, Emily is got the headphones on in like the distance,
yes,
and holding up the clock.
Yes.
And I'm always over time.
If you can make it to 45 minutes next season, I'll throw you a party.
When that happens,
yeah,
I'm going to literally text you and say,
please.
I did it for the first time.
And I'll know exactly what you mean.
Tell everybody where you're headed next.
I am headed to Citizens Union, helmed by
Shout out to Citizens Union.
the the amazing Grace Rao,
Shout out to Grace Rao.
who was a podcast guest, yes. And I'll be stepping in as Director of Digital and Communications. So looking forward to that. Everyone follow Citizens Union socials.
Look how she wove that in. I love that. Citizens Union, fabulous shop. Grace Rao is a superstar. Emily, they're lucky to have you, and I'm very grateful that we've had this time together to build this pod. The NYC Workforce Drop will continue. Ladies and gentlemen, Lauren Melodia is going to join us. And once again, wherever you are, give your shout out, give your love. Emily Kaufel, thank you very much for your time with us.
Thank you, Greg.
And the Hayes Initiative. Thank you. Lauren, thank you for joining us. It's good to see you.
Yeah, likewise.
Let's kick it off. Let's be honest. Let's put it right on the table. I'm going to ask you a question. How effed is the economic environment right now? Let's just start out right there.
Well, it's not good. I can say that. You know, some of the things we need in an economy to like have growth and inclusive economic growth include like a level of certainty that like things are going to be okay moving forward. And we have so many kind of macroeconomic and global challenges: war, the tariff stuff, artificial intelligence, that are all just kind of creating this uncertain environment that's making it hard for private businesses and the public sector to invest in the economy. And then, you know, that just leads to a pretty lackluster base to be building on.
I've heard it described as a low fire, low hire economy.
Yes.
What does that mean?
Well, it's kind of like some of the other terms that have been used is kind of like treading water.
That's it.
And so, you know, there's not a lot of new hiring going on. There's not a lot of people like leaving their jobs for other opportunities because there aren't real good prospects for other opportunities. We just kind of have people sitting where they are. And one of the things we know about U.S. history and kind of the structure of the U.S. economy is that in that kind of like stagnant economy, we actually see inequality get wider and bigger because people who have a hard time getting access to opportunity, there's really no place for them to go. And people who kind of have privilege or would have other opportunities in a kind of hotter economy are just kind of staying where they're at. So
we're locked in place.
We're locked in an unequal economy right now.
Locked in an unequal economy right now. There's no one I would rather talk to about this than you. To be honest with you, I'm not sure how many folks I know that are economists. I'm not sure I even understand all of what I read sometimes as I try to address and try to respond to what's going on in the markets and how it is that we think about economic development. And now economic justice is the hottest topic in town and what that means and what that looks like. And I'm just really grateful that you're here because I feel like we spend a lot of time in this podcast talking about workforce. We do some storytelling. Folks have reports that they're sort of digging into and sharing and connecting to. But I feel like you're the one when you put out stuff and it's like, here's where we are right now in this budget. Here's where we think we're headed or what we need to know where we're going. And I also feel like you've been laser-like focused on a number of different sectors and occupations that really need to be invested in right now because of the value that they sort of have in people's lives and also how it is that folks who are doing specific jobs, specific occupations need to be able to be resourced to be able to live successfully. I say all that to say I hope we can deep dive into this.
Yeah, let's do it.
And I fully expect as we do, I'm just going to ask a lot of questions. To those of you listening, some of these questions may not be the most informed questions. I mean, I'm a public administrations guy by training. I studied history in college. I'm still trying to figure out what the purpose of that was. And I'm in this particular moment now where I'm trying to catch up on things or try to wrap my head around things. And it's your judgment and guidance I really rely on to kind of figure out where we're going. So my starting point on, how effed up right now is a genuine sort of like, how effed up are we really? On that note, the most recent thing I heard and saw from you was related to something the workforce funders have been engaged in, which was specifically about how do we help folks find pathways to middle wage jobs. And if I recall correctly, during that presentation, that little snapshot I heard and saw, supported by the workforce funders, we got a lot of work to do to be able to get there. Is there anything particular you can share about that particular analysis that you were digging into on where we are going in that particular space? How do we help people find the good jobs? Because we started by saying we're stagnant in some ways right now, or we're treading right now, and folks who are kind of stuck in low wage, how do we get them to like point B? But we're really struggling right now, right, to find the sort of middle wage jobs?
Yeah, absolutely. I mean, I think across the city and across the country, we've been seeing this kind of hollowing out of middle wage jobs. And certainly this economic environment isn't conducive to building that back up. Mm-hmm. And so one of the things that we did in this presentation for the workforce funders is develop a framework, because we hear about how expensive it is to live in the city, and then how low wage many of the jobs are. We've seen in recent years that the largest growth in jobs has been in the home health care sector, which is an incredibly low wage sector right now. So we wanted to try to bring those two things together. Well, if you think about the cost of living, and you define middle wage as kind of like middle class or like a good paying job, how many people are actually fitting into that range? And so we kind of created this framework to think about this middle sector that could cover the cost of living that really, everybody should be in. A lot of people call that kind of like a living wage job, one that can cover that. But we wanted to get a sense of who's in that bucket right now and who's falling far below it. And certainly the middle is pretty tiny. I mean, we just have a incredibly stratified workforce in the city where we have a ton of people who are earning far less than it costs to cover the cost of living here. And then we have a small portion of people who are earning very high wages and seem to be able to continue getting bonuses and increases year after year in this slow economic environment. Yeah. So anyway, there's not that many jobs in the middle right now. And so I think the thing is certainly for workforce development organizations, it's really looking at what is in the middle right now. How can we design training and upskilling opportunities to get people into those jobs that have economic mobility? But then there's also looking at all of the jobs below that are high-value jobs that are just not valued in our economy right now because, I mentioned home health care. We also looked at the nonprofit human service workers and child care workers, and the vast majority of people working in those fields are earning far less than what the middle wage or the cost of living in the city requires. And we don't want to get rid of those jobs. We just need to make sure that they're paid better and people have benefits and economic opportunity.
How far behind where they need to be are they in those sectors?
Well, I mean, when you look at child care workers, we have not only people earning minimum wage as assistants, but we also have people running their own businesses out of their homes who are earning far less than the minimum wage. We did a study last year, a survey of family child care workers, and estimate that, when you look at the revenue people are bringing in, we know parents can't really afford what it really costs, but when you look at the revenue and you subtract all the costs, their take-home pay is $6 an hour. So that's, that's sub-minimum wage. And people say, well, how is that even possible? And it's because they're small business owners, so they don't have, a wage contract that guarantees that they earn a minimum wage.
These are early child care education programs, home-based, yeah?
Yes.
And I saw that in your report. Lowest paid workers in the ECE industry make less than the minimum hourly wage, as you pointed out, more likely to rely on public assistance than others in the city workforce, with half of home-based providers living at or below 200% of the federal poverty level. They are twice as likely to receive food stamps as others in the city's workforce. And this is a key piece of the puzzle. This is the city's workforce.
Yeah.
Rent-burdened, housing insecure, also significant. Overwhelmingly, by the way, immigrant women, women of color are involved in this particular sector. I was on a panel earlier today connected to economic justice. There was a lot of talk on the panel about systems and institutions and how they work and how they don't. And I think there was probably an important point made at some point during the panel, too, about, well, certain systems are created to disadvantage some people over others. How do we fix that? What do we do about that? I mean, for the early child care education providers, what do we need to do to right this ship?
Well, I think we just need to make sure that they get paid a living wage and that all of the contracts and voucher payments that public dollars go towards to pay for seats in their programs cover like the actual cost of care, including the labor costs. And this is a really tricky one, you know, because we're seeing all this excitement around universal child care, which is something that
hottest topic in town, or universal child.
Absolutely. And everyone I've talked to in family child care or who works in a center absolutely agrees this should be publicly provisioned. Parents can't afford what it costs right now. The costs don't cover the labor costs. This is a market failure, and if all of the seats were just covered by public dollars, then we could have high-quality, stable programs where people can build a career, move up from assistant teacher to program director, run a family child care program, and know that they can cover their rent, which is, you know, they work out of their homes. Like, this is critical.
Yeah, exactly.
The challenge, of course, is that when you build a universal program with, like, federal dollars, you know, the federal government, they can deficit finance whatever they want. They can just say, okay, we're going to put $20 billion into universal child care in New York State. New York City and New York State cannot do that, right? We have to balance our budget every year. It's based on how much revenue, the anticipated revenue, given current tax policy. And so we're rolling out a phased-in program where right now we have all these private businesses run out of people's homes. Some of the seats in those programs, parents pay for out of pocket. Some of those seats, parents pay for with vouchers that they get from the city child care assistance program. And some are part of that 3K pre-K and future 2K program that's paid through city contracts. But back to the thing of, like, how do we solve this? And my answer being, we need to just pay these people.
Is that the wage subsidy piece?
Yeah. If you're only paying for half of the seats, then you can't really guarantee that there's enough revenue to actually meet a wage standard. And so that's why other municipalities have already done this idea of this wage subsidy. Like, as we're rolling something out, let's guarantee up front we can pay people in this field. We're going to be paying directly for some seats, and we're going to cover the difference between what those private seats result in terms of wages and where we need that wage floor to be. If you don't do that, then, like, you're asking programs to institute new wage policies when they don't have sufficient revenue to actually cover it. And so then their choices are like, well, I guess I'll jack up the prices of the private pay seats I have in my program, which undermines the whole reason why we're doing this.
Exactly.
Or people close their programs because they're like, I can't make this work if only 3 of the seats in my 8-seat program are covered by public dollars and the rest of them are at the whim of the private market.
How much reliance is there on home-based providers?
I think that there's a pretty significant amount, particularly in the outer boroughs. We do know that about 70% of child care assistance program recipients utilize family child care, and that's the program where currently if you earn 85% or less of the state median income, you get a voucher that covers the majority of your child care costs. There's still like a copay, but you know it's pretty low, and so that's a huge component of it. There's about 7,000 family child care programs across the 5 boroughs.
7,000.
But they're small.
Yeah. The 8-seat, the handful of seats, that kind of thing.
Yeah. I mean, the majority of them have about 16 seats in them.
16. There it is. Okay.
But yeah.
And I will tell we NYCETC co-sponsored an event that was hosted at Gracie Mansion a couple weeks ago with the Office of Child Care and Early Childhood Education. And it was a room of providers that were being acknowledged by the mayor's office for their service and their connection and their commitment. And you couldn't possibly fit every dynamic, tremendous professional in that particular space because there's so many folks who are working so hard to do this successfully. There was probably a couple dozen folks in the room, and they were telling their stories, many home care providers in the room. Mm-hmm. And they were telling some of their stories. And the way it was sort of worked was people were sharing a little bit about their lives and people were talking a little bit about the programs. And it was very apparent very quickly the dedication, the passion, and the personal sacrifice that was being made by these professionals in their spaces and in their homes and in their work was so deep and so remarkable. And so I just had never been in a space. My history with working with like early childhood programs, I started my career at University Settlement, and I remember running a young adult program, and across the hallway was where the little ones were. And so I heard their songs, and I saw the foster grandparents, and I saw these magnificent meals being made and the vibe of the spaces and the educators in the space. So I know it from the settlement house perspective. I know it from, but I was thinking about the home care provide, the home child care providers. But so many of those folks were in the room being celebrated. And the number of times folks in the room were like weeping just by virtue of the power of their stories, who they are, how they've served, what they've been through in their own lives to be able to do this was tremendous. And I just thought the conversation was not about their economic stability.
Right.
It was not about mobility. It wasn't about replicating necessarily what's working or trying to figure out how to stabilize what might be challenging about what they're doing. It was just honoring the individuals. Mm-hmm. And all I could think was, it's great that we can buy these folks a nice dinner. I was happy to co-sponsor that.
Yeah.
But what do we need to do from here? So you're already pointing out the idea of what we have to think about when it comes to wage subsidies. Is there something too about rent burdens? Is there something too about how to support housing stability for this community, these professionals?
Yeah, certainly. I mean, the majority of them are renting their homes. This is a city of renters, so it's not surprising that family child care providers are also majority renters. And some of them have housing vouchers or live in NYCHA, but the majority of them are just private market renters. So I do think that, we do have kind of several voucher programs in the city. I mean, that would be a very clear and targeted way to provide some relief to these programs, to just, offer a rental voucher to people who are running these programs out of their out of their homes.
And the assumption would be this is presumably exponentially beneficial, that if we're able to stabilize those folks in a way that allows them to continue to do their work in a meaningful way, you help those individuals. But, I mean, they're building the next generation of who's our city, right?
Yeah, absolutely. I mean, this is the most critical part of a child's development, and I'm not a child development expert.
Me neither.
We talked about me working in the field of economics, and when I wrote this report on the family child care sector, many other economists were like, well, it doesn't look like it's working. So, like, this sector probably shouldn't exist if people are only making $6 an hour. And it's like, one of the things we ask people, it's like, do you still want to be doing this? We asked people in our survey, and overwhelmingly people are proud of the programs they run, feel very invested in the work that they do, know that they have a meaningful impact in their communities, want to continue doing that. So,
and are relied upon to do it.
Yeah, absolutely. Incredibly experienced workforce. The average provider's already been in business for 10 years. And in learning more about kind of why they do what they do and kind of the child development, expertise, I learned that it's really important at this age 0 to 5 for children to build a long-term bond with an educator. So you don't want kids going from like a 2-year-old's classroom to a 3-year-old's classroom to a 4-year-old's classroom necessarily with a new teacher every year. You actually want to be able to provide an environment where that child is able to bond with someone over multiple years of their life. And being able to stabilize this workforce that understands children at every age of development is just like the number one thing we can do to make sure that we have high quality care for people right now.
And, I'm so grateful to dig into this. And look, the Workforce Drop podcast has been about storytelling, the individuals who do the work, and how it is that work is demonstrating economic pathways, career pathways, industry growth, industry opportunities, et cetera. Fair to say at this point, if we could get early childhood education in a more stable space, and let's assume we get our human services support workers in a space where they are compensated appropriately and effectively, is it fair to say from your, economist point of view that will help our city? Because to your just point, there's other people who say, well, this thing sounds broken. It doesn't seem to work. Why are people doing it? Well, men shouldn't exist. But you come at this, I think, in a slightly different way, because always has sounded to me when we're in rooms together that you have a slightly different lens sometimes about what impact looks like and what value is.
Yeah, absolutely. I mean, when we think about economic growth, economic justice, we have to kind of look back to the theories of what economists say, and a lot of those theories have been debunked over time. But one thing we do know is that investment and consumer spending drive economic growth. And so if we value these essential workers who are doing all this care work in our economy, childcare educators, people who work in human services, who are highly qualified, doing incredibly hard work, who are underpaid right now, if we just paid them what they deserve to be paid in their field, that's like a really good economic development strategy right there, because those are New York City residents who are all of a sudden, rather than being like, how do I pay my bills this month, are going to be able to have like a chance for economic mobility, be able to like be engaged in the city in a different way, provide better services to the people that they are supporting. And that has this multiplier effect in terms of like creating new jobs and new economic activity in a way that like making sure that the top 1% get a 5% wage increase this year does not, because those people, they don't have any financial constraints, right?
That's right.
So giving them more higher wages this year, which I know is not a policy choice, but increasing wages at the top of the income distribution doesn't offer that multiplier effect, because people are just hoarding wealth or spending it on, in other cities and other, geographic regions. It's not going to induce as much economic activity as it would just supporting the people who are already doing the work here.
How'd you find your way to this particular career? What's the pathway that got you here?
Well, I did a lot of kind of community development, economic justice organizing work in New York City, and was very inspired by the people who I was trying to help advocate for, and came up against some of the constraints that we all experience in the policy world, where people are, oh, great idea, but there's no money for that.
Sure.
Okay, it sounds like a good idea to pay people more, but that's not really how economic development works. Economic development is all about these empire zones, like, all that kind of stuff. So I wanted to have the tools to fight back to overcome some of those challenges that I was facing. And that's how I got into learning about economic theory and all of the different methods to kind of put the numbers to the stories that we're already hearing. And I feel like for the most part, like, what economists do is we just quantify the things that people are already aware of, I don't think that this family child care survey project that we invested years in necessarily uncovered anything that people didn't already know. And one of the quotes in the paper that is my favorite is, we did all these focus groups with people. This is before we analyzed the data. We collected all this data to analyze take-home pay. And someone was like, I know how much we get paid. we earn $6 an hour. And then we did all the math.
They knew it. They were like,
They
we
knew
know
it.
what it is.
Yeah, exactly. We pay our staff $16.50. That's minimum wage, and we get $6 an hour at the end of the day. And so I think that is the power of doing this kind of research, quantifying things, and that has some power to it for sure. Like I know that the work that we've been doing has been really transformative for people advocating for improved labor standards all across, the city. But it's also just very much reflecting the reality and, being able to quantify things so that policymakers can really hear it.
I think there's something really important about how it is that information gets shared with policymakers, how we talk in terms of the quantitative and qualitative sort of from the qualitative and quantitative perspectives. To your point, it's striking to me the number of times in the course of my career where people thought they could influence a policymaker because something seemed wrong or seemed, well, that's not good. We should fix that. And to your point, the easiest response to that in some ways is, well, we don't have the money to fix it, or we don't necessarily know how to get our hands around it to be able to fix it, or we have 25 other things to fix,
right.
So it doesn't become the priority. Yeah. So as you conceptualize, you put your reports together, how is it that you want them to be received? How is it that you feel like you have the best success at putting your reports and your content together so that they're as digestible as they are?
Well, I think being able to cost out what the policy change looks like is really powerful, and we don't always get to do that in all of our reports because sometimes we're just trying to solidify, okay, this is where the policy should go. But I do think every time we've done cost estimates, they've been, incredibly valuable for being able to move the needle. But not always. I mean, we've been doing estimates around improving temporary disability insurance in the state.
Yep.
And, kind of lobbyists on the business side will come back and say, well, we have a different estimate. And you look at the numbers and the assumptions and it's this doesn't actually add up or make sense. But they have a level of influence. They can use their scare tactics. Businesses are going to close or leave the city.
Yeah.
So in that case, it's the cost estimate doesn't necessarily, it's not enough. I guess it's just about being flexible to the moment. Sometimes policymakers just need to know how many people are going to be impacted by something that I'm advocating for. Sometimes they need to know, what is the cost? I think being able to explain things in more of a, this is going to be the return on investment or this is the economic impact is stuff that we haven't done a lot of, but I think that, more and more that's where we need to be going to help kind of build momentum for big, bold policy ideas.
And we've talked about this too. You and I have had some conversation about if we want to be in a space where there is influence and value, we've got to beat the drum. We've got to come at it in a way that folks can digest. We have to present alternatives and strategies, and we have to figure out a way how to become a priority.
Yeah.
I saw your city FY27 budget estimate. City must address child care budget gap for low-income families and low-wage workers, June 2026. Here's what you say. Given these outcomes of the state budget process, it is critical for city government to fill these gaps in the city fiscal year 2027. This entails an additional investment these are the investments that you flagged.
Yeah.
Clearing half of the child care assistance program waitlist, $500 million.
Yeah, it's a big one.
And then the next one, yeah, okay. And the next one is a family child care stabilization grant fund, $168 million. Is there anything you want to say about why those were the things that you were focused on that the city must address when we talk about this policy issue? Those are not small numbers.
That is true. They're not small numbers. These ideas come out of the child care workforce community. Family child care workers, people who work in nonprofit centers, see the plan for what we're going to do for child care in the next year and know that there are some unintended consequences that will result in a loss of childcare educators, a loss of programs if we don't stabilize the sector. And so, you know, I know that the city and the state are kind of thinking, like, how do we build out a path to universal childcare? And policy can be, you know, we can redesign the whole thing. We can make it finally work after decades of, you know, underinvestment and kind of a broken, fragmented system. And it's complicated. And I think that there's a way in which policymakers really need to be listening from people who run these programs. And you can probably, you know, you can say the same thing about any field, really. It's like you only have, if you're building top down, you're not going to really know how things play out on the ground. And so family child care providers have been advocating for this child care assistance program for years because that's how families get care right now. It's not a perfect system. They're not asking to actually just get paid a living wage. Like the big focus is like, let me serve my community, because they know that that's actually the easiest thing to implement right now that's going to impact the most people. And, you know, I think the city is going to be rolling out 2,000 2K seats this year, and we need to make sure that as the city's expanding new program ideas in this space, it's not undermining existing programs. There's 25,000 kids on a wait list for this program. They're already eligible for it. There's just not enough money in the budget for it. So, I mean, it seems like problematic to kind of build new programs without making sure that these existing ones can just operate.
Well, you know, as a city, I think we're good. We're much better at trying to make a new thing than we are stabilizing the scaffold.
Yeah.
Or adding layers to the particular scaffold that we want to work from. Great line from this. City policy history demonstrates that a failure to address gaps now result in the loss of childcare supply. During the city's rollout of pre-K and 3K, and there are still folks reflecting on how that was beneficial and challenging in a number of different ways. During the city's rollout of pre-K and 3K, the city did not address these gaps and provide stabilization funds and permanently lost 1,300 family child care programs with the capacity to serve 9,850 children. It's hard not to read that and think, what's preventing us from learning from what we didn't do right before? How is it that we're not going to replicate this same challenge or issue?
Yeah, and I mean, there's also a really positive lesson from COVID on this, interestingly.
COVID comes up in every podcast because we're all immersed in having lived through the most thing we could never possibly imagine. But look here, okay, go ahead. Here are the lessons from COVID. Go ahead.
But we also had all this federal funding that
huge.
Was flexible.
You got a dump of a lot of money.
And the city and state used it well, and they knew, okay, people can't go to work. Some people can't go to work. Some people have to go to work. There's these child care programs that are operating all over the city. We need to stabilize them. We need to make sure they don't close their doors. And so there were these stabilization grants for 2 years during COVID to just make sure that regardless of how many kids you have coming in every day, like you can stay open and you can cover, you know, any of the new requirements to, you know, keep your space safe and healthy for you and your clients. And the city only lost 100 programs during that time period.
Really?
Yeah, 100 family child care programs were lost during COVID compared to 1,300 during the rollout to pre-K, which makes no sense because you think about pre-K, we need more child care workers. But just the dynamics of, like, the ratios with, you know, the students by age, and then, like, not everyone gets a contract to do 3K, only some of them do. And so it just created all of this, churn that resulted in this loss that I think absolutely, yes, we should learn that lesson and make sure it doesn't happen. And, you know, that's why there's this focus on this stabilization grant in this city budget request. There was a bigger request for just stabilizing the workforce broadly statewide that didn't make it into the state budget the past couple of years. So, you know, this is, you know, us trying to target it a little bit. Like, given where we're seeing the rollout of the child care plans at this stage, where are the biggest areas of concern that are going to require some stabilization? And I think family childcare and people on these voucher wait lists, low-income families on these voucher wait lists are the biggest kind of risks right now.
And you gave that number. That's the 25,000.
Yeah.
25,000 children on a wait list to access the CCAP program.
Yeah.
Which subsidizes childcare for low-income families. Families on the CCAP waitlist weren't able to utilize the city's existing NYC public schools programs, important to note, because their children do not fit into those age ranges. Their work hours were outside the 9-to-5 schedule, or there are no available seats near them. 25,000 children.
Yeah, it's a lot.
And if I understand, okay, so the stabilization grant fund, this one, $168 million, to boost the take-home pay while mitigating program closures. What's the likelihood that this is something that we can move on?
Well, I think there's a lot of advocates pushing for these. Again, these were kind of state advocacy asks and have been. The Child Care Assistance Program wait list is kind of a legacy of the Adams administration, and it's complicated. It kind of came out of nowhere and caught everyone by surprise. But really, if you look at it, it's just this program is popular. It works. It's not perfect. It doesn't pay providers enough to cover the cost of care. And it should cover all families, you know, but otherwise it works. It's like you qualify, you get a voucher, you can spend it at any program that's willing to take the voucher. You have just all of the licensed programs at your disposal to pick and choose from. So Governor Hochul expanded eligibility for it a bunch, increased some of the reimbursement rates a significant amount. So it has just gained popularity in the past couple of years. And so I think that there's a lot of people who have been pushing for it to be the vehicle to expand to universal child care, but also to just make sure that this program works while we build a better, different, more comprehensive system. So I think that there's a lot of momentum, and we'll see over the next couple of weeks if City Council and the Mayor's office pick up on that.
And speaking of, this podcast will drop, I'm going to check the date right now. It'll be July 9th.
Okay.
When this podcast, so by that point,
we'll know.
Right. So right now, if you're listening to this, it was the second week of June. The Knicks literally just won, and we're super excited about that. That's all anyone in the city. But we'll know whether or not this made its way.
Yes, absolutely. And, you know, this is just the beginning of a multi-year plan to build out a better, more sustainable, more equitable child care system. So I think we're learning a lot from this year, and those lessons will help influence kind of policy design and moving forward.
If we're going to remake the early child care education models in an effective way, is that something you believe is something that we can remedy over the course of one term of a new administration?
You mean fix all the problems or serve all the families?
Both.
Or,
Both.
It depends how much money there is to invest in it. There are certain really boring details on the implementation side about how all the different agencies talk to each other through their technologies. I mean, those things are going to take time to fix, but I mean, I think really it's just kind of if we can have enough money in the system, then we can serve as many families as possible. I would just argue that any new funding has to have living wages attached to it. And that's not where we're at right now. We're expanding a system, by exploiting women of color who work in this field. And that's not going to last for very long. There's the cumulative impact of being undervalued for so long. People are going to walk away from these jobs or, get burnt out. And so when I say we need to have the money in the system, we really, really need to make sure that it's enough funding. Our center has been working on a cost model to kind of map out, what's it going to cost to cover all the 2-year-olds, all the infants, all the 3-year-olds in New York City, in the rest of state, to build kind of statewide and city level, realistic cost estimates that include two requirements. One is there's a sector-wide salary scale here. People are getting paid a living wage. There's opportunities for advancement. And two, that the contracts and vouchers cover the cost of care, meaning not just the wages, but the benefits, the commercial or, residential space that people rent, the utilities, the food. We have to keep in mind these programs serve children food every day,
That's right.
So we need to just make sure, and those two assumptions are not part of how current contracting exists in this space. So I think that's the big challenge.
Meaning those contracts are not as comprehensive in addressing all those different needs as they would need to be, and certainly not funded to be comprehensive.
Right.
Is that correct?
Yeah. The current contracts or voucher rates don't cover all of those costs and or any sort of wage. Some of the city contracts have some wage standards in them, but, statewide, that's not the case. So
Why is that? The absence of those standards, the absence of those expectations, from your perspective, given the expertise, the knowledge you have, why is it that some things get built or some things are in motion that have the kind of gaps that I think are pretty significant? Is it simply a matter, to go back to the initial point, which is, listen, we're in an effed up economic environment right now, so we don't have the revenue and we don't allocate the resource? Or is it something else about how it is, again, as you flagged, that disproportionately we put the weight of expectation on people we undervalue and under-resource, women, immigrants, et cetera?
Well, I do think that we undervalue care work and people working in these fields, and you can see that reflected in all these contracts and all these negotiations. But I also think that we don't do a very good job of budgeting infrastructure projects, And so I think part of the challenge here is that politicians want political wins, and sometimes they'll say it's only going to cost X number of dollars. I was actually looking back at what de Blasio had announced 3K would cost. Way under, really underestimated the cost.
Yeah, didn't meet the number.
So when we don't do good budgeting and we don't build in the assumptions, and when policymakers feel restricted by current law, then we're not building good plans for what it's actually going to cost for things. And then it means not enough resources are allocated to those things. And when it comes to care work or human services work, the result is exploiting the people who work in the field, making sure that they don't have the stability that they need and deserve to do their jobs well. But you can also see it, in physical infrastructure projects, projects start and then they stall, I think those ones, though, are more visible for people. And so, whereas the U.S. economy has been exploiting women of color since it began.
For all times.
Yes. So it's this thing that always kind of, gets pushed off as we'll deal with it when we have the money.
Or it's the system, and that's the system that was built. That's the institution, and that's because your system's broken. No, the system's working exactly the way it was built to work.
Yeah.
Right. Tell me, how do you, given all of what you're reflecting on, you're reporting on, how are you feeling about this administration's commitment to economic justice?
Well, they're committed to it, so that's good. We've got a deputy mayor of economic justice.
Never on the first Julie Su, Deputy Mayor Julie Su, as noted, has said that we've never done this before. This is a new role. The deputy mayor, by the way, extraordinary history of service, public service in the country, for the country. And but we've never seen that before. Economic justice has not been something this city has talked about before. Is that going to help us?
I think it's important to put it out there as a goal, and then that allows us to make sure that policy is designed to achieve it. But I think that there's a lot of challenges, particularly in the fact that the mayor also ran on a kind of affordability agenda for everybody amidst an effed up economy where, you would need substantial federal investment in things. I look at childcare and kind of where it's at right now and some of the trade-offs that are taking place that I find very concerning and unequitable. And think about some of the conversations happening around the City FEP's voucher program, where, there was a big push, we need to expand this, we need this thing. I don't think anyone would argue against that in city council or the mayor's office, but we don't have the funding for it. And so some of the thing is like, some of the negotiating right now is like, maybe we can't expand it until we have federal funding to support it. But you could also say the same thing about universal child care.
That's right.
Like if we don't have enough money for it, then we need to be more targeted because there are trade-offs taking place, whether it's underpaying people in the field or serving 2-year-olds, regardless of income eligibility, while leaving infants who live in low-income households on a wait list. So I think that, those are some of the challenges that that if you have an economic justice lens, you're going to have to confront those things with every kind of affordability or economic policy agenda that you push forward. And I think, we're still in the early stages here, but I do think having a commitment to economic justice is going to force some interesting kind of conversations around, like, when can you do something that's for everybody, and when do you really have to target it to really meet the biggest need. And, I mentioned earlier, like, the importance of raising wages for nonprofit human service workers, childcare workers, home health care workers, being a way to generate economic growth by just putting more money in the hands of people already doing that incredible work. But that's like hundreds of thousands of workers in this city, largely women of color, who are already working in that field. That's also a way of achieving economic justice, like targeting wage policy reforms on people who are currently experiencing a racial or gender pay gap because of the field that they work in being undervalued. If we could boost wages for those people, it generates economic growth for the whole city through a multiplier effect, but it also is a targeted economic justice policy choice that could be made.
Well, and it's supposed to be the ideal situation is that this is interconnected, right? Like the idea of setting the North Star with economic justice, as you pointed out, absolutely critical, because if we're not going to start with a conversation about equity and access and equality, if we can't start there, it's hard to have any reasonable pathway forward, right? But I've got to intersect that with how it is that we grow, because I got to be able to think about how we use resource. But then I've also got to be strategic, as I think you're pointing out, if this is fair to say. If I solely paint with a broad brush, it may be very difficult to get to that North Star.
Right.
I actually have to start by pinpointing where it is that I can focus the effort to collect, let's assume, political wins at the same time as I improve people's lives. And then presumably that means that we start to build a scaffold from there.
Yeah.
The downside, of course, of that is then that doesn't sound like you're satisfying the initial objective you set, which you presumably ran your campaign on, which is we're going to have universal childcare. Well, what if it's just a narrow scope to start? That doesn't seem universal, does it?
Right. But I think that we have a mayor who's really good at communication. And so
I've seen that.
I think if anyone can do it, can say, this is the North Star and this is the economic justice path to it, people will stick along for the ride.
I hope you're right about that. And as we wind down here and we think about sticking to the ride, can you tell me what life is like on the New York City Rent Guidelines Board?
Well, technically, I'm not allowed to talk to anyone about this.
You can't say a word about
that's
it.
That's not true. But this is airing on July
9th.
Okay, so yeah, I got a little bit more freedom then.
Yes.
We'll see what happens. We've got some really interesting public testimony hearings happening in 4 of the 5 boroughs. So
we're not gonna mention what the 4 are. What's the process, by the way? So you have hearings, or you have convenings.
Yes. Well, first we had a bunch of public meetings where people just gave us a lot of data.
Got it. Okay.
And then we set a range. We were like, given the data, this is the range we think, rent increases should take place in over the next for 1 and 2 year leases. And now there's public comment at these 4 borough events where people can just sign up to testify and tell us how they feel about the ranges and also kind of challenges they're seeing. And it's an interesting kind of quantitative, qualitative situation because, obviously people are very excited about the possibility of freezing the rent. And yet...
The other big broad brush, universal child care, freeze the rent.
And yet rent is already unaffordable for most of the people who come and testify to us. So freezing it just means keeping it the same. And there's all these other kind of quality of life and accountability things that people are bringing up. And so, this process happens every year. It's been interesting to kind of learn about it in this year and think about how it can be used to leverage other kind of big picture issues related to housing, because freezing the rent is just like one tool. It can't solve the housing crisis. So, but I think that we're learning a lot and people are participating in this a lot. And so hopefully there will be some other kind of policy ideas that, come out of this.
You got your hands around the child care conversation. You're digging into housing through this effort. What else are you focused on? What's next? What is and what's next for you?
Oh, wow.
Maybe a better way to say it is, what's on your mind that you'd like to be active in or more active in terms of addressing critical New York City issues?
Well, I feel like the child care piece is a huge one, and I think
enormous.
I've done so much work on it in recent years. I'm kind of like, I'm not going to get distracted by other interesting things.
Gotcha.
I need to lean in and do the work here to support an equitable and sustainable path to universal child care. But
I admire the focus on that.
It doesn't solve all the problems, right? It's
That's
not
right.
going to instigate economic growth. It's not going to solve the unemployment crisis that so many people are facing in the city. And so, I think one of the things that I'd like to put more time into, or have our team put more time into in the next year, is just developing a inclusive economic development plan, which there's not a lot of good models out there of what the city has done in the past.
That's right.
But, there's also a lot of smart people working on these issues on the ground. Can we synthesize some of that so that there's targeted efforts to deal with rising unemployment of men of color, the city's black-white unemployment rate gap? These are huge issues. The declining labor force participation of immigrants. A lot of these things are connected to what's happening at the federal level, not surprisingly. But, there's an opportunity to think about some new ideas in that space. And I think that's a challenge I'm hoping to participate in.
Count us in. Count in the NYC, ETC players, our universe, in all of those different conversations, because they're core to everything that the providers, regardless of who they're working with or how they're working with folks, are thinking about and focused on. And we've always been a policy and advocacy, NYC ETC has always been a policy and advocacy sort of engine, or at least thought of as something that should be putting forward significant policy and advocacy agenda items. That said, how do we talk about workforce without talking about housing? How do we talk about workforce housing without talking about childcare? How can we possibly not think about food justice, either as part of what people have access to and also who's staffing these particular sources? So, this is where I feel like workforce fits into a lot of conversations.
Yeah.
And to what it is I think that you share, the ability to talk about what policy can be, what we have learned from the past, to try to make a digestible sort of shape and form to say, here's what we need to do differently, as opposed, I would suggest, to just trying to create a new thing to sort of sort out a lasting and painful problem, is something I think we're both in the business of trying to figure out. And I just wanted to note how much I appreciate every report that comes to the table, how we always champion them, we always will at ETC. And anytime we get to learn from you, partner with you, engage with you, is a benefit to the entire coalition. And it's all about, at the end of the day, trying to figure out how to make New York City work in much better ways than it does right now.
Yeah, absolutely. Yeah.
So I thank you for your partnership. I thank you for your engagement. And I just want to say, let's continue to do this together as we tackle affordability, childcare, and figuring out what economy is going to work for working New Yorkers.
Sounds great.
On On that note, Lauren, we got lots to do from here. Happy summer.
Happy summer. It's July.
It's July. Perfect.